Good afternoon and welcome to today's webinar featuring a new report from Smart Growth America, the State of Transportation and Health Equity, a field scan of the biggest challenges to health equity facing our transportation system and the strategies we should use to address them. My name is May Hanslick and I'm a part of the team who worked on this report. We are thrilled that so many of you were able to join us today to learn a bit more about the report's findings. I'd like to first review the agenda and logistics for today's webinar. This webinar will provide listeners with an introduction to this report. We'll start with reviewing the report's purpose, methodology, and organization. We'll then provide a high-level overview of the challenges and strategies outlined in the report. Finally, we'll conclude with a question and answer period. If you have any questions throughout the presentation, please share them with us in the chat box located in the lower left-hand corner of your webinar screen, and we'll try to answer as many questions as possible at the end of the presentation. I'd like to now turn it over to Emiko Atherton, Vice President of Thriving Communities at Smart Growth America and Director of the National Complete Streets Coalition. Emiko oversees the Coalition's federal advocacy, communications, research, and technical assistance programs. She has used her expertise in transportation policy, public health, land use, economic development, and legislation to consult with communities across the United States on how to create better transportation networks. Emiko is an international voice on complete streets and has spoken to audiences across the country about the value of this approach. Emiko, I'll let you take it from here.
Thanks so much, May, and good afternoon or morning or evening wherever you might be joining us. Today on this webinar, as May said, my name is Emiko, and I'm really excited to share this new report from Smart Growth America today. I see many friends who have joined us, so I welcome you to ask questions throughout this. Just as a reminder, May did say type your questions in the lower left-hand screen, and we'll be able to answer them at the end. So let's get started. I want to first start by talking about what is health equity. So as you know, this report is titled The State of Transportation and Health Equity. But I think it's important for all of us to ground us in the definition that we used, what my definition is, and to encourage you to think about what your own definition of health equity is. For the Robert Wood Johnson Foundation, they define health equity as health equity means that everyone has fair and just opportunity to be as healthy as possible. So what does that mean in your lives? For me, this has a lot of meaning because I grew up in an area called Rainier Valley in southeast Seattle in the late 70s and 1980s. And this was at a time where the community had gone through a lot of disinvestment. And what that meant is it was pretty unsafe for me to walk to the bus stop. My parents had to put us in a car to drive about 20 to 30 minutes to get fresh food because the local grocery store had rotten apples and broccoli. It meant that health care and other things for my neighbors were harder to attain. And so that I knew, although I didn't know what was going on, that for my family and the communities around us, our choices and our opportunities to be healthy were limited based on the community and the built environment that surrounded us. This is true for communities throughout the country, and although we've made improvements, I think we still believe at Smart Growth America there's a lot of work to be done in our communities to increase access to really health and health equity for all Americans, but particularly those in the most vulnerable populations. So let's talk about this report. So why this report? This field scan is part of a larger effort that the Robert Wood Johnson Foundation supported in order to understand the most promising opportunities to achieve equitable public infrastructure. So in addition to this report, there were 3 other groups that looked at the areas of broadband, energy, and water. But why do this now? And this is something I really want to drive home. Coming from really the transportation end, and I think many of you who are joining us on the phone would say, we know what the solutions are today. We know they're right in front of us. We know that adding a sidewalk saves lives. We know that something as simple as a crosswalk, narrowing lanes, narrowing roads, providing protected facilities for people on wheels, providing street lighting, as long as with how we regulate our land use, how we support public transit, these are the things that build healthier, more prosperous communities. This is something that we don't need to explore anymore because we have the research. I always say we have the cure, now we just have to use it. And yet at the same time, many communities are experiencing drastic inequities due to transportation. We see pedestrian and bicycle fatalities on the rise. We see the effects of climate and climate change in each and every one of our communities, and we see economic inequality continue to grow and grow. So why aren't we able to then enact these solutions? And what this report really looked at is what are those 6 barriers? Why aren't we implementing these tools that we all as a field can agree on are working? To do this, we used a multi-pronged methodology. We started with a literature review to make sure that we knew what the best thinking was in the country and around the world. We were able to interview 92 experts who really are thought leaders on cross-cutting issues of transportation, public health, equity, community building, arts, and culture. We then coded and analyzed the data using a software called NVivo. We convened 30 of these experts to start to really ground truth our findings, and we also worked with a communications consultant to really focus in on narrative development messages, which is one of the things I'll talk about first. And what we found through all of this is that there are 6 critical areas that surface to the top. And I'm going to dig into each one of these, but let me talk about them quickly. 1, we're not communicating effectively. Although we have those solutions, we're not telling those stories. We're still at the government level, misspending and misallocating funds, using poor decision-making and weak leadership, while leaving out communities out of the transportation decision-making process. We continue to work in silos, and all of this is happening as we are displacing communities through development while insufficiently investing in people. So what do we do with these barriers? We identified 6 strategies that I'll go into, as well as 40 sub-specific strategies that we hope each one of you can use throughout the community. The report is organized by each of these 6 strategies, and you can see that in the report. On top of the fact that within each strategy, we identified at what level of government we feel like change is needed, who can be responsible for this change, and where does it fit in what we call the 5 Ps: policy, process, politics, people, and practice. Because each of this is going to take efforts at the national, state, regional, and local level. It's going to require all of us who are on this webinar today, whether you're an advocate, you work for your DOT, you've been elected to office, you're an individual advocate, or you've been, say, elected to your land use board. And it's going to take policy change. It's going to look at your processes. It might require getting engaged in politics and changing who's in power. It's going to require the community and then really practicing all of this. And then to do this, let's start with strategy 1. We really identified the strategy 1 first, which is to reframe the transportation conversation because we felt it was so important. One of the things our research led us to find is that the current messaging, narratives, and language around creating equitable transportation systems are not working. Those who care about health equity, which is many of you on this, if not probably most of you on this call, are failing to motivate our policymakers or help them understand the implications of their actions. In one way, we're speaking to the choir. And we need to learn how to meet people where they are and reframe the transportation conversation in ways that people care about. As part of this work, we actually worked, as I mentioned, with a communications consulting firm who started to test messages with voters of all political parties and socioeconomic backgrounds throughout the country about messages that they really felt might inspire them to take action on transportation. What this research found is although even when people identify with this message, they're still not inspired to take action. So we need to start looking at it. What are the words? What is the stories? And who are those messengers that we need to tell these stories? So this is connecting transportation messages to the issues people care about. People don't vote on everyday transportation, but they vote on jobs. They might vote on schools. They vote on economics and really what's in their bank. And so how do we connect those messages to the things voters care about and their elected officials? We need to educate the press so they understand our issues are more than the morning traffic report. And then we need to use who are the trusted messengers, and often that's not us. I think about a story, I used to serve on my local bike advocacy board, and at the same time that I did that, I got a job working for an elected official. And one of the things my new boss told me, who's the elected official, is that it was very hard as someone that represented a district that was mostly people of color struggling economically and struggling with really racist policies to listen to advocates that showed up in spandex bike suits that cost more than some of her constituents brought home every month. And so who are those messengers? We need to use demonstration projects, and what we mean by that is actual projects that people can see as a communications tool. I think it's often, what are the solutions? People can't imagine that, so how do we help with imagination? Telling stories to change hearts and minds, and then making our materials easy to understand and share. A feature that we wanted to share is really work that Transportation Alternatives and Families for Safe Streets in New York City did to work with the media about changing how they use the term accident to crash. And this was because using the word accident really put the onus on those who are often struck and injured, seriously often are killed. And turning it to a crash makes it very clear that this was something that was not an accident at all, but a result of our poor street design. And as a result, the Associated Press issued guidance to reporters to avoid using the term accident. Our second strategy is that we need to start allocating funding and resources equitably. At all levels of government, transportation funding and resources support projects that still prioritize car travel over getting people where they need to go in a safe, convenient, reliable, and affordable way. Said another way, we put the speed of vehicles over actually the mobility of people and goods and services. So how do we do this? We need to start at the federal level, which really sets the tone for the country, and fix federal policy by creating a national vision for transportation, one that wants to connect people to destinations, not just jobs, but everywhere they need to go. It might be their place of worship, healthy food, health care, social institutions, but how are we not just about creating speeds or roads for the sake of roads, but actually getting people where they need to go regardless of modes? We need to set performance targets. We need to hold our states accountable for actually improving safety. And I would be remiss in not saying we also need to pass a binding federal complete streets policy, which really requires our states and metropolitan planning organizations to consider all users when they're planning the system. Which said another way, and really, when I think about how I talk on Capitol Hill here in Washington, D.C., to make sure all taxpayer dollars are reflected in how we spend their money. We need to then fix state and local policy. I'm going to quote a former colleague of mine at Smart Growth America, Raja Mallar, who is now Secretary of Transportation for the Washington State Department of Transportation, who really said we need to start changing the DNA of our DOTs. And what that means is we need to really look at not just one policy, but really what is that DNA that has created agencies across the country that can continue to deliver highways and prioritize speed over safety or other goals that we care about. We need to create budget transparency, adopt and implement policies that prioritize the needs of disenfranchised populations, and we actually need to build better projects. We need to put our money behind our mouths. And that means how we change how we pick projects, taking time to make sure project scopes are correct, and integrating health into our existing work. The example I want to highlight here was also pioneered by another Smart Growth America colleague, who is now the Deputy Director of the Virginia Department of Transportation. And VDOT, or Virginia, which is not known, I think, politically as always one of the most progressive states, has one of the most transportation progressive ways it selects its projects. And it's called Smart Scale, and I encourage everyone to look it up. It wanted to figure out a way how it actually picks the projects it's going to build. And so it identified 6 factors that people in Virginia care about. And Virginians care about congestion, they care about the economy, they care about accessibility, safety, environmental quality, and in their larger cities, coordination with land use. And what this did is it gave them a way that communities could submit projects to the state, and then they would rank them against all of these as well as costs. And what they found is time and time again, Complete Streets projects, the value that they delivered over the cost meant that they were funding more, and they continue to fund more Complete Streets projects than ever before. It doesn't mean they aren't still funding highway projects and other major arterial projects, but the Complete Streets projects also have, are reaching its way to the top. The third strategy is we need to not just change the decisions that people make, but we actually need to change the decision makers. And this is by improving the quality and diversity of transportation leadership. Poor decision making and weak leadership at all levels of government has created a built environment that is not easy or affordable to fix. Our decision makers need to better represent our communities, especially the most disenfranchised populations, and must commit to advancing a people-centered transportation vision. Well, what does that mean? Sometimes it means training who we already have, but what it really means is getting different people in those seats and in those leadership positions. But this requires supporting and investing in the future of the field. We need to hire more diverse leaders, but also redefine what we consider expertise. What does it mean to have expertise in the community? We then need to provide and require training to existing staff. We need to institutionalize the connection between health and transportation and higher education. And then we need to prepare all communities for new mobility and technology. One of the things that I think about this in the context of transportation is many of you might be familiar with an organization called COMPTO, which is the Conference of Minority Transportation Officials. And when I first met COMPTO, I had a question about why so much of their leadership came from the transit sector of transportation versus my world, which was more pedestrian and bicycle infrastructure. And the response was actually transit has done a better job of bringing people up from entry-level jobs into CEO positions than any other field, because you don't need a quote-unquote higher, fancier, say, engineering degree. So someone can start as a bus driver and over time make their way up into leadership. But we've not done that through the other transportation sectors. We don't do that through health, and we still prioritize certain expertise over others. So looking at why stories of what happened in COMPTO, how do we change that throughout the transportation sector? A case study I wanted to highlight here was in Houston. There's a coalition called Together for Safer Roads, which is a global NGO that builds public-private partnerships to improve road safety. And they will started work with one of their member businesses in the city of Houston to increase safety along a really dangerous road in the Gulfston neighborhood. Together for Safer Roads intentionally kept the project's scope focused on one corridor to ensure visible change would happen within the year. That, again, goes back to demonstration projects. But they invested over $100,000 in staff time, technical consulting, grant funding, which was matched many times over by the Houston Department of Public Works. Their shared goals were to transform an 8-lane road into a street safe for everyone, especially vulnerable road users, and to use the project to catalyze change across the city. As part of the project, Together for Safer Roads partners, Connect Community, which is a local Houston-based nonprofit, worked with an engineering consulting group and hired local high school students for a STEM-based summer internship. And this engineering firm filled an important gap for the city by facilitating a community engagement process to inform the redesign. The students developed traffic safety solutions, worked closely with the Department of Public Works, and pitched their ideas to the City Council. And through this internship, students gained relevant transportation experience, built connections, and learned how to make tangible improvements in their community. So this was an opportunity, again, to start changing that next generation of who's making those decisions in transportation. Our fourth strategy is to prioritize historically underrepresented communities in transportation decision making. Without revisiting the history of transportation in the United States, we know that what we understand as the modern highway system was really a result of the 50s and the National Highway Act of 1956, which built what was to me intended a uniform transportation system, where really engineers were in charge and then empowered using racist policies and practice. This, really left the community and continues in the legacy to leave the communities out of decisions that happen within their community. And they've had communities, particularly marginalized communities, have had very little power in influencing what happens in their communities. Therefore, we need more authentic, meaningful community engagement, and it needs to be collaborative, not an extractive process. I think probably many of us on this call have been to public meetings where we're asked to share our input at a time inconvenient to us, and then not seen our input used in any way. And so it feels very unmeaningfully. So what does it mean to actually then, moving into some of the sub-strategies, give up power and make space for these disenfranchised communities to drive decision-making, remove barriers to participating, and that's really basics. When are you holding your meetings? Where are you holding their meetings? Are they transit accessible? Are you compensating people for their time? Are you offering food and childcare? How does this, because if you think about it, even in my own city of Washington, D.C., most of my community meetings happen at night, and if I worked at night, I would be unable to attend those. We then need to hire staff who are reflective of the community and pay those community consultants for their expertise. We need to stop tokenizing people and recognize them as partners in the table. We need to organize opportunities, so while we're doing this, we're building the capacity of the communities, and really to make this fun. This can happen in all different ways. It could happen really at the government level by changing how funding gets allocated. There are cities who use participatory budgeting or deliberative democracy now, like the city of Pittsburgh, Pennsylvania, to actually have the communities make decisions about how that funding is used. But there's also opportunities to engage the community in different ways. One of my favorite organizations is in Minneapolis, Minnesota, called Asian Media Access. And it's run by a phenomenal woman named Angie Wang. And this organization has been serving the area for now over 20 years. And it really believes that the community perspective needs to be the foundation for discussion, but understanding that using the typical way that we've engaged the community doesn't work for the immigrant and refugee populations in Minnesota. So they use things like working with children to spray paint multilingual stencils on sidewalks to encourage walkability. They have hot pot dinners to have deep and thoughtful discussions. And then for many of, particularly the older constituents of Asian Media Access, English might not be their first language. And so instead of relying on written public comment or even verbal, they use visual stories, they do collaging to make sure that those seniors' voices are heard. And I highly encourage everyone to check out their website. They're just a phenomenal organization. The fifth strategy is we really just need to work better together. We say it here is work in unison to provide people-focused infrastructure, but this means getting out of our silos and getting out of our egos and our lanes and coming together to collaborate. This means building partnerships across disciplines. This might be within your city, so public health reaching out to transportation or public works, engaging law enforcement. You might be engaging parks, someone you hadn't thought about before, your budget office, building political capital along the way, creating a diverse base of knowledge and skills within internal government teams. So this really gets back to not just partnerships, but how do you have shared skills and knowledge? How are you actually speaking the same language? I laughed that when I worked for a county government, those who worked in DOT and public health actually spoke different languages. And I worked for the council, and part of my job was just to translate. And then to continue to offer trainings and share resources. How can people train each other? And then make the transportation decision-making easy to understand. Transportation decision-making is not that hard. But we have made it incredibly hard to understand in a way to keep people out. And so how can we make sure that process is explained? Here, one of the things I wanted to feature was a conference that we held 2 years ago in Nashville, Tennessee, called Intersections, which was the first time we brought together really complete streets advocates, creative placemakers and artists, and equity advocates to problem solve around issues of transportation, equity, and justice. And I love this quote from someone that received an art place scholarship to attend, that it was really a turning point. This is an artist based in Nashville who learned that biking and walking and art can be used as a strategy for neighborhood transportation, and how this conference and just this opportunity to share with different disciplines working in the same community transformed her capacity to impact her neighborhood. And this is just one of the examples of ways that you can bring people together. Another example is a project that we did with the city of Orlando and the county that they wanted to work on really transforming a 5-lane roadway into a 3-lane roadway, what many of you might know is a road diet. And they really used this opportunity, participating in a Safe Streets Academy that we offered. The city normally doesn't get to work on county maintained and operated roads, but it was one of their highest crash corridors. So they decided that together, along with law enforcement and public health, they wanted to do this demonstration project. And as a result, the city and county forged a partnership to work on safety and other similar projects in the future. The last strategy I want to cover is that while we do all these investments, as we make our communities better, we must invest in communities without displacement. I want to bring this back to the story that I told about my own neighborhood growing up. And I mentioned again that I grew up in Southeast Seattle in the late 70s and 80s, at a time when I couldn't get my friends from North Seattle to come visit me. That my mom didn't want me walking to the bus stop at night. What happened in the 2000s was that a light rail was put in about a half a mile from my house, and has drastically transformed Southeast Seattle. And if for those of you who follow kind of Seattle, you'll know the longer story. But what happened is that the area quickly experienced a lot of investment in particularly neighborhoods like the one called Columbia City. Unfortunately, there's also been a lot of displacement that has happened because housing affordability has risen dramatically. So we need to think every time that we touch the transportation system, how are we creating opportunities for the people that currently live there and the communities that we really were forced to stay there as through white flight and urban sprawl? How can they take advantage in the opportunity that's coming? That requires measuring displacement and rewarding projects that allow residents to remain in place. We need to strengthen guardrails on existing investment tools like opportunity zones. We need to improve strategic coordination between land use, housing, and transportation. And this goes back again to the silos and how they're all related. Transportation might not have a direct say in how housing or land use is built, but they're all related. And then we need to build shared prosperity through these transportation investments. One of the features I want to highlight is the 11th Street Bridge project here in Washington, D.C., for those of you who are familiar with it. So in D.C., the remnants of an old bridge are being transformed into an elevated park, which will bring a new civic space for healthy recreation, environmental education, and the arts. The team at the 11th Street Bridge project has been working for years to ensure that the park will be a driver of inclusive development that existing residents will benefit from, especially those who live on the east side of the Anacostia River, which has experienced decades of disinvestment. So the team's equitable development plan outlines specific strategies to guide development in 4 areas, which are workforce development, small business enterprises, housing, and arts and culture. And for example, the Bridge Street project will prioritize hiring neighborhood residents from underinvested areas, as well as hard-to-employ district residents for construction and post-construction projects. And I want to point out again, this is a transportation project, but involves workforce development, small business enterprise, housing, and arts and culture. That really this is a multidisciplinary approach, and we cannot work in silos. Something else that's going on is really an update to zoning practices. So we have used zoning in this country as a way to segregate communities, but also to continue to allow types of development that may not be good for affordability or for the environment. However, there are cities like Minneapolis or states like Oregon that have recently updated their zoning practice to allow for increased housing access. In Minneapolis, both of these happened last year. They updated their comprehensive plan to allow for more housing choice in single detached housing neighborhoods. So essentially, I think the headlines were they got rid of single-family zoning. But what this really allows is for more building, for multi-use, mixed-use, denser housing to happen. This is also happening in Oregon, which passed a bill that will preclude zoning exclusively for single detached housing in cities with populations larger than 25,000 people across the state. So how can you take a role in advancing health equity through transportation? So again, we know what works. We know that crosswalks and sidewalks, buses and bikes all work, but that we need to get these implemented. And we believe that these 6 critical areas with 40 strategies are what's needed. And really, we don't think that those 92 experts and all the people that we talked to really supported this. But it will require everyone listening on this call to work with their partners to improve the system from both the inside and out. You can find the report on our website at smartgrowthamerica.org under resources. And then when you type on resources, it's the first resource that comes up for now. And with that, we are going to move over to the question and answers. We made sure to save a lot of time for question and answer. And so as a reminder, if you have a question, please type it in the lower left-hand corner. And then we will be able to get to everyone that we can. If we cannot get your question today, we will make sure to answer it in our recap blog, which we share a few weeks after the webinar. Also, I know that people had a question whether this is being recorded. This is being recorded as the slides will be available. We also make this webinar, the recorded webinar, available in closed caption. So we encourage you to share that. Great, and I'm going to turn it over to May to ask questions.
All right, we've got several questions here. The first question is, can you speak a little bit more to strategy 1, reframing the transportation conversation? Are there any additional resources or the research that you mentioned that you would recommend to assist advocates?
Yes. So thank you so much. This was one of my favorite parts about this report is really how do we talk about transportation and connecting it to messages people care about. First, I would say please email us. We've got some resources that might be a little too wordy for me to read off right now, but we really found in work that we did with a communications consulting firm that messages that I think resonate with all Americans have to do with most Americans, regardless of where you are, want the freedom to move. The American dream is really rooted in this idea. If you think about driving with I think about a 1950s image of driving in a convertible with the top down and your hair in the wind used to define the American dream. You're out on a Sunday drive. It's not really possible anymore. If we're honest, most of our real experience in cars is being stuck in traffic. So what does that freedom to move mean? People understand the fundamental right to access jobs and other services, and yet transportation is the #1 barrier to accessing jobs, healthcare, and other essential services. The Federal Reserve Bank lists reliable transportation as the #1 barrier to employment. And another way to think about that is, what job application doesn't ask if you have reliable transportation? Any job where you're filling out a form, that's one of the first questions that you answer. So again, connecting it to messages, I think that most people can identify with. But if you email us, we're also to share some of those more refined messages that we were able to work with a firm and do some voter testing on. But I think about, within your own community and the transit ballot measure, think about engaging businesses. Businesses intuitively get that they want employees that are reliable and that can reliably show up. And they don't want someone calling up, they can't make their shift because their car broke down. But that's a really common story. Businesses also get that walkable streets and livable streets are economically vibrant streets. and that's something that they get. One of the case studies that we highlight in the report that I encourage you to look at is actually the Transit Ballot Initiative in Indianapolis. That really it was to create their bus rapid transit line. It was championed by a Republican mayor who really understood and galvanized the business community to get excited about bus rapid transit as a way to provide more reliable transportation options for people to access jobs. So great question.
Great. Next question is, we have a question from somebody in a rural community in New York who's wondering how would they go about finding whether their community has a Complete Streets program?
That's a great question. So if you go to our website, we do have an atlas of all of the policies, and we can make sure to share that in the recap blog, or you can also contact May, but we have a whole section on the Smart Growth America website under Complete Streets where we have, we put out every year a Best Complete Streets Policies report, as well as a catalog of all the Complete Streets policies that we know about, and it's now over 1,500 that have been graded, and our new report should be coming soon. But feel free to reach out to us too if you have more questions beyond our policy atlas on our website.
Great. Can you explain a little bit more about how to build political capital?
Yeah, that's a great question. I think it has to do probably with where you're working, but maybe I'll start with a story and hopefully this answers some of the questions. Political capital to me really requires, do you have capital to influence change? And who has that credibility to do so? In a community, or I'll tell a very personal story. I spend every other week on Capitol Hill in some form or another meeting with a member of Congress's staff to talk about change that I hope happens. And I've got to be really honest, the meetings that are just me don't go that far. And the meetings that are very powerful is when I'm able to bring somebody in from that community who really knows that community well. And that's an example of political capital. Another way is I've actually gone out and worked in that community, and I can speak about that community because I'm a member of that community. And so it's that type of political capital. Political capital is also about making sure that you are electing people that are going to, that have the political capital then to make change, but are reflective and are going to vote and represent your community's interests. So it depends. I think about it the same way you might think about social capital is political capital, you know, who can call on. And so those are some of the ways that I think about political capital in this context.
Great. We've received quite a few questions about VDOT Smart Scale.
Yeah.
If people are interested in figuring out more about the Smart Scale process, where would they first go for information?
So a great place to go, so I'll recommend two websites. First, please go to VDOT Smart Scale website, but I also encourage you to visit our Smart Growth America website and look at our SSTI, that's our Smart State Transportation Initiative program. They're another branch of Smart Growth America that actually works with VDOT to create Smart Scale and have done some of that work in other communities as well.
Great. A question here. How can we fund transit and complete streets in states like Ohio that ban gas tax funds from being used? These taxes encourage expanding highways with little benefit to health. Is there advocacy at the federal level to reverse ban on funding transit operations at the federal level? Our local taxes are already very high, leaving transit and complete streets with little options.
Yeah, I think that's a great question. So first, it's very unfortunate that what's happened is that because the gas tax at the federal level hasn't been raised in over 20 years or adjusted for inflation, states and communities are really suffering from transportation dollars. We are lucky that there have been some cities with voters who have been willing to support ballot initiatives. I mentioned the one in Indianapolis, but we've seen them in all types of cities and counties and states throughout the country. Unfortunately, I will say that does put an undue burden on because one, I think more progressive cities are willing to adopt those, and so it creates a bigger divide between the have and have-nots. Also, in almost all of those cases, they are what we refer to as regressive taxes, and so they end up taxing the poor at a disproportionate rate to the wealthy. And so the real fix for transportation is really fixing federal transportation funding and reform. And that's exactly what you need. And so I think that was a really an astute point. For those of you that don't know, this fall, our current transportation policy, which is called the FAST Act, or the Fixing America's Surface Transportation Act, will expire, which means there's an opportunity. It only comes every 5 years to redefine transportation and transportation funding in the country. We at Smart Growth America, through the Complete Streets Coalition and Transportation for America, are working to really see transformational change. So we're doing this through the Complete Streets Act that will not just encourage states to consider all users, but will create a grant program. We're also encouraging, we are advocating the federal government and Congress specifically to make major overhauls in transportation policy that won't just get at funding, but will actually get at spending on better projects. I would say we need to look, before we look at raising money, we need to look at spending money better. We spend billions of dollars a year building highways, and it's not solving congestion. We now know that building more lanes doesn't do anything in the long term because we just induce demand. And so we really need to think about how are we actually creating access to destinations. Then we talk about more funding, but it is absolutely through federal transportation reform. There are a lot of ways to get activated. Please contact us about the Complete Streets Act and some of the work Transportation for America is doing, and we'll also include that in the follow-up blog.
Great. Another question here. What are some tips for engaging underrepresented and underreached populations who, due to historical exclusion, may now be reticent to engage in an entity in design and planning of a project?
Yeah, that's a really good question and a very fair question. I think that there is very little reason that most communities should trust government. Most disenfranchised communities have no reason to trust government. What we need to realize is it starts with building that trust. So it starts with who in that community might be willing to work with you and really be a translator with that community. It also means starting where people are and what they need before going to them with what you need. What I've seen a lot is that communities might want to, as cities, they might want to put some bike lanes in a community, and they go in and they experience immediate resistance from the community and assume that the community doesn't want bike lanes. And what the community many times wants is just to be listened to and hear about what are the things they need. Why are there bike lanes coming for new residents when their streetlights haven't been fixed in 20 years? So how can you actually go out and ask people what they need, build that trust before asking them for anything, and working with some trusted advisors. Work on really hiring from that community, and I say hiring because that means compensating them, and really spending that first amount of time figuring out what you can do for them before ever thinking what can they do for us.
The next question here is about the Intersections conference that you mentioned. We have a participant wondering, will there be another Intersections conference?
Yes,
Oh my God.
We hope to make an announcement in a few weeks, but it will be later this year.
Great. All right, a little bit more complicated question. Can you speak more to the impact that infrastructure has on crashes versus the impact that behavior or culture change have on crashes?
Yeah, great question. So I think what a report many of you may know about who are listening on this call is called Dangerous by Design. And we call it, and it's a report that looks at the most dangerous places to walk in the United States. We call it Dangerous by Design because many of our roads in the United States were actually built, as we've talked about, to prioritize high-speed travel. And what that happens is that those become dangerous for other uses. Many arterials or major streets that we know in our communities were actually built with the same principles as highway design. Now, highway design, and all of us have been on a limited access freeway, is wide lanes, wide roads, big shoulders, not a lot of curvage, not a lot of elevation, and very limited access. And that's actually pretty safe. However, when you apply all of those principles with access, you get really a recipe for death. And when I talk about that is most of us are familiar with major arterials, and so you get the wide lanes, the wide roads, you get fast and flat, but then you add access. So think about a major arterial community that has a Best Buy, that has a Big Lots, that has a Safeway, and all of those have driveways. And each one of those become conflict points if people are walking alongside them. We essentially, again, are prioritizing. That's what I mean when I say prioritizing the high-speed travel. You might look at the posted lane. The posted speed of that road might be only 25 miles an hour, but people are allowed, but people just by design are going to drive faster. I think about when I was learning how to drive, my parents taught me not to drive the speed limit, but to drive the speed of other drivers. And what happens is that you're driving to the design speed of that road, not the posted speed, and we're still designing for higher speeds. Another way that streets might be, and so when you think about trying to cross that roadway, it's very long. So not building a crosswalk, or a crosswalk might happen only every quarter mile, and yet there might be a mall on one side and a bus stop on the other. And so people are running across because that's really the only viable way within a half mile to get across that. Or the crossing time might not be enough. If you're an older adult or have a mobility challenge, just making it across an 8-lane main street takes too long, and so you get struck in the intersection. And so it's basic things like that. That's not to say that behavior change isn't part of it, but that we believe at the Complete Streets Coalition can fix a lot of that by getting people to slow speeds, and one of the best ways to have speed slow down is through design. That if you limit a people's ability to speed by things like narrow lanes, adding, cutting into their peripheral vision by adding things like a street tree or a bump out, those basic things will actually naturally cause a car to slow down, make people pay attention. It also, when you lower the speed of a vehicle, upon impact, the speed at which a car hits a person largely determines whether the crash is fatal or not. So again, lower speeds result in less fatalities.
Great. Here's a really good question that very much focuses on strategy 6 about investing without displacement. The participant asks, how do you reconcile the fact that transportation investment, especially investments like Complete Streets, raise housing values in the area of improvement and can ultimately lead to people being displaced from their homes through higher taxes, higher rents, and increased housing prices? Yeah,
that's a great question, and unfortunately there's no silver bullet answer. I think we talk about this a lot at Smart Growth America, and this really gets back to, it's not just, if you are a transportation professional and you're looking at that and that's a concern of your city or community, how do you engage housing into that? How do you engage workforce development? How do you engage the local businesses? Because often what you have is you have people who are displaced because it's no longer affordable. So can you actually, why isn't it affordable? Are they homeowners and the taxes go up? Are they renters and they're worried about their rent prices going up? So looking at things like that. You're also looking at things like small business displacement. I live in a community that really, I think, is struggling a lot with what it means to maintain its original character and going through a lot of business displacement. Because often people no longer feel like even if they're able to afford to live there, does the community still have businesses that reflect the needs that they want? Or they feel, we now have a candy shop, a bulk candy shop in our neighborhood. It's a high-end, it's like a high-end yuppie candy shop where I think it's like $12 a pound for some gummy candies. And does that really reflect the needs? You know, it's taking out local barbershops and nail salons. And so looking at small business investments, making sure that the people who are there might have opportunities to take out small business loans and open small business opportunities there, that they, again, people who live in the neighborhood might, like the 11th Street Bridge project, might be able to participate in the construction, and even if they're not in that, to do through an apprenticeship program and learn the trade. Construction jobs are often can be good living wage jobs. So, you know, the answer is, unfortunately, there isn't one great answer, except making sure that as you do that, you're working with housing, you're working with workforce, you're working with small business enterprise, you're working in land use. One of the main reasons that things go up is, one, it becomes more desirable, but supply decreases because more people want to use there. So can you increase the supply of housing and make sure that that maintains, that affordability in that supply is maintained? So those are the things that I would be thinking about in that case.
Great. We've got a question here that speaks to strategy 4, and they're interested in learning more about how you would pay for community consultants. So that idea of hiring staff who are reflective of the community, how do you actually operationalize that? Like, who would pay for it? Where would you get those funds?
Yeah, that's a great idea. It's a great idea and a great question. So if you are a city, I guarantee most of you have hired consultants to help with your planning. They've either helped with your planning or construction. And so looking at it in the same way that you look at setting aside money for your consultants, you would use that same pot. I think, where there's a will, there's a way. We pay, and I love my consultant friends. I love my consultant supporters, but we pay them a lot of money to create plans. And to help us with our work. And if we think of our community members with the same amount of reverence and respect, I think you're able to find the funding. It is redefining that expertise, though, will make someone. You might be looking, though, on a really practical level are there organizations, intermediaries that you can connect community members with who can become, help people incorporate as a business. They might be able to, how can you can connect people, so how can you register as an LLC? How can people register as a DBE? Helping people get connected with the resources so that they become viable vendors. And so you might want to look at procurement and vendor selection within your city and see, are there things standing in the way of being able to, at a very practical level, hire those community members? Can you connect them? Is there a local business that's willing to subcontract with them? So looking at kind of creative ways, because I'm going to guess that you're going to get most stuck up in kind of the procurement process. And so you might be able to identify a consultant that's willing to do that as a sub. So thinking again creatively about what that might look like.
Great. A question here about the future and technology. How do you think technological advancements in transportation are going to impact health equity?
Yeah,
positively, negatively?
So I think the answer is it's up to us. I think, I always tell people we need to remember that all the technology at the end of the day is a tool, and it's a tool that we can use for good and bad. I think it's up to us to make sure that, and when I say us, it's organizations like Smart Growth America, that when discussions about new mobility are being had, that it's not just the private companies and the cities, but that we're pushing for community members to be at the table as equal partners, and to redefine that table. It's making sure that really that information is getting out there, and that we're continuing to use it to push our original agenda. So one, I think it's the first issue I want to speak to is what I've seen with technology is a lot of money and new partners flooding the market in a way I don't think we've experienced before. And when you look around the table at those discussions, if you made their pants a little bit looser, it would look like the same people making decisions in the 1950s, which is 30 to 60-year-old white men. So how do we not let this? We've seen history. How do we not let history repeat itself? How do we put pressure on the cities to require the companies to be better? But also we need to keep companies on the hook. I have seen with scooters, companies asking cities to make sure that they put a certain amount of their scooters into some communities of color or low-income communities. Well, that's not right if we're not willing to put the infrastructure there too. That's irresponsible of a city to put things like scooters and claim that will solve first and last mile access if we're not willing to put in the same protected facilities that we're willing to put into our central business district in downtown. So thinking about it in that way. So putting pressure on both our cities and the private companies to be in the room, because these tools can serve for good, but they can also continue to perpetuate and worsen the inequities.
Thanks. There's a question in here asking about complete streets, and how would somebody figure out if their state has signed on or their national ally has signed on to support complete streets at the federal level?
That's great. On our website, you can actually, on smartgrowthamerica.org, if you go to the Complete Streets section in the Complete Streets Act, you can actually look for your member of Congress and see if they've signed on or not.
Great.
And if they haven't, we encourage you to write them.
Lovely. One more question, and it's kind of a tricky question. With respect to measuring displacement, do you have any good examples of how to do that or who's doing that?
Yeah, so that's a great question. It's hard. I think kind of one of the best examples I've seen of that is a report that the City of Seattle did on measuring displacement and what's happened as a result of investments and tracking displacement. We'll make sure to include that as well in the recap blog. I would encourage it, because it is a really tricky question, and I think the City of Seattle did an outstanding job to refer to that report. But we'll make sure to share that as well.
Excellent.
Yeah, I would like one other point with that too. I think it's really important to measure displacement, and I think the report that the City of Seattle did is critical and something other cities should replicate. I also need to think, if you don't have the tools to pull off a large quantitative analysis of displacement, you'll see that most of the reports findings in this report were generated through qualitative analysis. And I think you can go out there and ask community members, and you'll be able to tell that story directly through interviews and through stories and through really that qualitative work in your community. So I wouldn't let the data scare you off, because data can be both quantitative, which the City of Seattle did, as well as qualitative.
Great, thank you. I apologize to the folks who we didn't get to your questions. We had so many questions and we were only able to answer about half of them. But like Emiko mentioned in the beginning, we'll try to make sure we answer those in the follow-up blog post, which will come in the next couple of weeks. We also wanted to leave a little bit of time here at the end to make an announcement to join us for another webinar. Next week we will be talking on Friday about equitable complete streets principles in school communities. You can register on the link there, and we'll also be sending that out in the follow-up email as well. So thank you to everyone who was able to join us today. Like Emiko said, if you have any questions and you'd like to follow up with us directly, please don't hesitate to reach out. We'll include contact information in the follow-up email. Emiko, any last words to add?
No, I want to thank you, everyone. This was great, and I encourage you to check out all those resources. A big thank you to May, who wrote this report, and please continue to reach out to us with questions.
Great. Thank you all.